Hello friends, welcome to the channel Dewdear Academy. In this video, I am discussing the topic in pediatric nursing. So start each day with a positive thought. And the topic in the pediatric nursing is dehydration in children. So I am discussing the topics related to the fluid requirements and also the management, the questions related with these topics, the fluid requirements and management in case of dehydration in children. So let me move on to the question first. So the first question is, an unconscious child come to OPD with dehydration. The nurse do first. Options: start IV infusion of RL. Option B, reassure the patients. Option C, reassure the parents. Option C, give ORS to the child. And option D is consult doctor. So these are the options given here. The question is the unconscious child. The main important thing is the child is unconscious and has dehydration. Okay. So what is the first nurse's responsibility? Whether to start the IV infusion of RL or to reassure the parents or give ORS to the child or consult the doctor. So these are the four options here. So let us analyze each of the options here. The first option is start IV infusion of RL, ringer lactate solution. So when an unconscious child presents with dehydration, it is crucial to prioritize their immediate needs. So if the child is unconscious, it can lead to respiratory complications and also the cardiovascular complications. So the main concern in dehydration and unconsciousness are maintaining adequate hydration here. That is, maintaining the blood pressure and prevent the electrolyte imbalances are the major responsibility here. So IV infusion is the fastest and it is the most effective way to address this problem of dehydration. Okay, so IV infusion is the fastest and most effective way in managing these patients if the patient is unable to take the oral fluids as the patient is unconscious. So the first option given here is correct answer here, because it is the first and most important responsibility to hydrate the patient, because the patient is unconscious, the patient can't take the oral intake. So we have to hydrate the patient by starting the IV infusion. The second option is reassuring the parents. Reassuring is very important. The parents are to be reassured, but the priority is first stabilizing the child. So the nurse should be focusing on the immediate medical needs like hydrating the patient. And so the option B is not correct. Then we have option C, that is give ORS to the child. Oral rehydration solution is appropriate, but that is effective for mild to moderate dehydration. That will be effective to mild and moderate cases. But here we have the patient is unconscious, so that is a severe case. So the giving ORS is not the priority, because in case of unconscious child, it is dangerous to administer the fluids orally because there can be risk of aspiration. So IV fluids are important to restore the hydration quickly and safely. So that is the giving ORS is not the correct answer. Then we have option D, that is consulting the doctor. So while a consultation with the doctor is essential for the proper diagnosis and also for the good management, but the nurse must immediately initiate the life-saving interventions, that is starting the IV fluids, mainly when the child is unconscious. So the nurse should notify the doctor as soon as possible. As the situation is, once it is stable, then they can notify the doctor, but the first priority is starting the IV infusion of RL. It is the best and immediate intervention to correct the dehydration and maintain the hydration and electrolyte balance in this unconscious child. So here we can see the correct answer is option A, start IV infusion of RL. Then we move on to the next question here. That is the first step. What is the first step in the management of a child with severe dehydration? Options are start oral rehydration therapy. Option B, immediate blood transfusion. Option C, administer IV fluids. And option D is monitor blood pressure. What is the first step in the management of child with severe dehydration? So here also the topic is the patient is having severe dehydration and the first step in management. So we can analyze again the options. Start oral rehydration therapy. So oral rehydration therapy is appropriate, but anyway I have already discussed in the previous question that is mainly effective for mild to moderate dehydration. This is effective, mild to moderate dehydration. In case of severe dehydration, ORT alone is insufficient because the child may not be able to tolerate oral intake if there is severe vomiting or any altered mental status or any severe illness or problems. The patient may not be able to tolerate the oral rehydration solution alone. So it is important that child requires rapid rehydration with intravenous fluids. So option A is not correct. Then we can analyze the second option, that is option B, immediate blood transfusion. So a blood transfusion is indicated for children who have significant blood loss or if they are in shock due to anemia or any other hematological conditions. So in case of dehydration, unless there is any severe blood loss or shock from another cause, a blood transfusion is not the first intervention. So that is not correct. Then option C is start or administer IV fluids. This is the correct first step because severe dehydration requires rapid and effective fluid replacement to restore the electrolyte balance and to improve the circulation and also to prevent the shock. So IV fluids are typically administered to rapidly rehydrate the child as they allow for more control over the volume and type of fluids given, and also it helps in ensuring more immediate recovery. So this is very important. Usually isotonic saline or ringer lactate solution is given, like an initial bolus of the IV fluid is given, and then it will be followed by continuous fluid management based on the response of the client. So the IV fluid, administering IV fluid is the very important priority here. That is the correct answer here. Then monitoring the blood pressure. Option D is monitoring blood pressure. So while monitoring blood pressure, it is important in tracking the response of the child to the resuscitative measures and other treatments we are given, but it is not the first step in managing the dehydration, mainly severe dehydration, because the priority is to correct the dehydration and restore the circulating volume with IV fluids. So that is the management. So option D is not correct, and the correct answer here is option C, administer IV fluids. So the first question and the second question is almost having the similar content or similar meaning. Anyway, the first step in management of the child with severe dehydration is administer the IV fluids. The next question, which intravenous fluid is most commonly used for rehydration in severe pediatric dehydration? Options: ringer lactate, normal saline 0.9%, then 5% dextrose, and half normal saline 0.45%. So the question is, which intravenous fluid is most commonly used for rehydration in severe dehydration? So the IV fluid which is most commonly used, that is the question here. So the first option is ringer lactate. Ringer lactate is a isotonic solution containing sodium, potassium, calcium and lactate ions. Okay, this is an isotonic solution. It contains sodium, then potassium, calcium and lactate ions. So it is often used in case of severe dehydration and shock because it helps to replenish both the lost fluid volume and electrolytes. So this is the fluid of choice for rehydration in many pediatric emergency situations, like the case of severe dehydration and all. It helps addressing both dehydration and also it addresses the metabolic acidosis. So that may mainly cause metabolic acidosis may be followed by this problems with the diarrhea or vomiting. So this is very important, and we are administering lactate also in oral, so that is metabolized to bicarbonate, and that can also help in correcting the metabolic acidosis. So this is the reason we can say the most common choice of rehydration is the ringer lactate solution. Then we have the another option, that is, so option A is correct, and option B we can check the normal saline, that is 0.9%. It is an isotonic solution, but it contains only sodium and chloride, sodium and chloride. So it is often used for fluid resuscitation, but it does not contain any additional electrolytes like potassium, or calcium, and it does not correct metabolic acidosis also. So it may be used in case of rehydration in some cases, but it is less ideal for prolonged hydration, or when if there is any acidosis present, this is not ideal. The Ringer lactate solution is more ideal here. And we have the next option. So option B is not correct. Then option C, when we are analyzing that, it is 5% dextrose. So 5% dextrose in water is a hypotonic solution. 5% dextrose in water means it is a hypotonic solution with glucose. So when it is used to provide calories for the patient if they are not eating, or if there is any electrolyte loss and all. In order to provide as a calories, we are giving the patient 5% dextrose. So even if we are using that as part of the maintenance fluid strategy in less severe dehydration, but for the initial resuscitation or in case of severe dehydration, 5% dextrose is not a management measure. Then we have option D, that is half normal saline, that is 0.545% or half normal saline. That is a hypotonic solution. So this is also a hypotonic solution. Okay, this is also a hypotonic solution containing sodium and chloride, but it is used in the maintenance fluid therapy in less severe dehydration cases, or for patients who need prolonged IV hydration. We are using half normal saline, but that is not the correct measure. So the correct answer is option A, Ringer lactate, which is an isotonic solution, and it contains sodium, potassium, calcium and lactate, and also it helps in case of managing the patient with severe dehydration, and also it helps to combat with the metabolic acidosis. So we move on to the next question. A child presents with mild dehydration, how is oral rehydration solution administered? Options: 10 ml per kg every 2 hours, 5 ml per kg every 5 minutes, 50 ml per kg over 4 hours, 100 ml per kg over 24 hours. So the question is mild dehydration, and how is oral rehydration solution administered? So ORS solution or ORS is administered for mild dehydration. How we are administering? That is the question here. So the different options are also given here. So when a child is presenting with mild dehydration, in order to restore the fluid balance, ORS is administered. And the first option is 10 ml per kg every 2 hours. So this amount 10 ml per kg is too low for effective rehydration, and the interval is every 2 hours. So that is not providing enough fluid to counteract the dehydration. So that is not correct answer here. Then we have 5 ml per kg every 5 minutes. So that it is important to give frequent doses of ORS in small sips. But what happens is, if we are giving 5 ml per kg every 5 minutes, that may lead to increased consumption in a very short period. So that may cause vomiting or discomfort to the child. So this option is also not correct, because we are giving 5 ml per kg every 5 minutes. That is not correct. Then we have 50 ml per kg over 4 hours. So this is the correct approach here, because for mild dehydration, we are administering ORS, and it is administered in this amount, that is 50 ml per kg of body weight over 4 hours. Okay, ORS can be administered as 50 ml per kg over, gradually we are administering over 4 hours. So this allows effective rehydration in a safe and manageable way. So that option is correct. Option C is correct. Then we have option D, that is 100 ml per kg over 24 hours. So this is too high a volume, because especially for mild dehydration, it would be used for moderate or severe dehydration, and it can be administered over a longer period, but not for mild cases. So the correct goal here is to replace the lost fluids gradually and avoid overloading the stomach or causing vomiting. So for mild dehydration, the focus is on gradual rehydration over several hours to restore the hydration levels. So 50 ml per kg over 4 hours. In case of mild dehydration, we can say the estimated fluid loss is 5% of the body weight 5% of body weight is the estimated fluid loss. So the recommended oral intake, ORS intake, that is up to 50 ml per kg of ORS for 4 to 6 hours. Okay, 50 ml per kg of ORS for 4 to 6 hours is the recommended ORS intake, and the child should be given that in small and frequent sips. In case of, this is in case of mild dehydration. If it is moderate dehydration, the fluid loss is 6 to 9% of body weight. The fluid loss is around 6 to 9% of body weight. So the ORS can be given like 100 ml per kg of ORS over 4 to 6 hours. So when we are classifying that as mild and moderate and severe, we can see here. So this is case of mild and this is in case of moderate. It will be 100 ml per kg of ORS for 4 to 6 hours. And in case of severe dehydration, it can be the fluid loss is 10% or more of the body weight. So we are not recommending ORS for severe dehydration, but the management should be done with intravenous fluids. So from this recommended ORS intake, we can understand for mild dehydration it is 50 ml per kg over 4 to 6 hours. If it is moderate, it is 100 ml per kg for 4 to 6 hours. So here the correct answer in case of mild dehydration, it is 50 ml per kg over 4 hours. Then the next question, a 5-year-old child weighing 20 kg is admitted with mild dehydration. What is the 24-hour maintenance fluid requirement for this child according to the standard maintenance fluid calculation? So the 5-year-old child weighing 20 kilograms, the weight is 20 kilogram and having mild dehydration. So what is the 24-hour maintenance fluid requirement? Options are 1000 ml, 1500 ml, 1800 ml and 2000 ml. So 1000, 1500, 1800 or 2000 ml. What is the correct answer? So the daily maintenance fluid requirement is calculated like the formula, that is for the first 10 kg. For the first 10 kg, 100 ml per kg per day. If the for the first 10 kg we have to give 100 ml per kg per day. Okay, so what happens here? 100 ml per kg per day. So that becomes 10 into 100, that is 1000 ml. Then for the next 10 kg, it is 50 ml per kg per day. 50 ml per kg per day. So for 50 ml per kg per day, it becomes 10 into 50, that is 500 ml. So the child is 20 kilograms. So the first 10 kg, it is 100 ml per kg per day. It becomes 100 into 10, that becomes 1000 ml. And for the next 10 kg, it is 50 ml. So it becomes 10 into 50, that is 500 ml. So total is 1500 ml. So this calculation is very important for hydration management in pediatric patients. So the correct answer here is 1500 ml. So these are the important questions related with this topic, the dehydration in children. I hope this video is useful for all of you. Thank you.